Awesome. Hi, everyone. Thank you so much for joining us today for our month's first HRSN partner work session. Next slide, please. Next. A little bit of Zoom, our housekeeping. Please use the chat to ask questions, because we really like our sessions to be interactive, and that is one way we get more information about what we want, where we are, and everything. And that also means that if people want to instead ask questions verbally, we do have time after our first half of the session, and then also after the second half of the session. As you might have gotten that information about it being recorded. And for live captioning, please click on the CC button at the bottom of the screen, or click the link provided for Spanish captioning. For live interpretation help, please click on the interpretation button and choose either English or Spanish. Next slide, please. As always, we'll do a bit of group polls. Can we start that, Trevor, while I provide the background for it? So first one is county or region. This, I know I have been saying it all the time, that we use these polls to see if we are not reaching to any particular county or region and we need to amp up our activities, our efforts to reach those regions. So please click on these polls and let us know where we stand. Benton and Clackamas County has the highest presentation. Followed by Coos and Douglas. Nice. Lane County, awesome. Oh yeah, Multnomah. 75% of the participants have already attended to the poll. Great. Is everyone able to see the results on their screens? So today we do not have anyone from Columbia, Clatsop, Gilliam, all of these, and that's right. Okay, now let's go to the second question. Oh, sorry. This is sector, because whenever we want to reach out to specific groups, so with regards to our specific programs, we would like to know what type of sectors we are reaching out to, or how we can reach out more to more organizations from that sector. So this will be super helpful for our partner mapping. I'm so glad we have so many CBOs, community-based organizations, present here today. That's great. We have few healthcare organizations and behavioral health services too. Housing, local government, thank you for joining us. Great. So almost 30% or 1/3 of our participants today are from CBOs, community-based organizations. The next highest is local government, and then housing services organizations providing housing services and behavioral health services following the healthcare is following that. Thank you so much for attending to these polls. Great. Now let's go to the next session. Next slide, please. So most of you are aware of today's agenda. We share our broad agendas in our invitation and email. So first, as always, we'll go through the 1115 waiver background. Most of you might be already aware of it, but then some people are always new. And so we would like to make it very clear about what we are working on. And this is a step forward on that. Then we'll talk more about HRSN service authorization and delivery timelines. We want to share more of this information so that as community-based organization, you are aware of the timelines of the services that you are supporting your people you're helping, your clients in getting the services and how to get them on time. And this is one of answerability. Then we'll go to community capacity building funds. I know we have presented a lot many times on community capacity building funds, but we do realize that there might be some things that are not completely comprehensible or situations arising that we might not be aware of. So we will be talking more about this and taking up, so this is more of on office hour format. So we will be soliciting questions and we'll be responding to them. With regards to that, we had shared a slide deck and a PDF of FAQs, frequently asked questions, so that we have questions which are different or in much more details than probably presented in the FAQs. And we'll be very interested in learning more about them today. Following that, we'll have question and answer session. Next, please. Next slide. Now, Jessie Wilson will take over. Thank you, Jessie.
Thanks so much, Satya. Hi, everyone. My name is Jessie Wilson, she, her pronouns. I'm with the Oregon Health Authority. I am the 1115 Waiver Strategic Operations Director, and happy to be joining today to provide a little bit of an overview here. Let's go to the next slide, please. So just a little context setting, reminder on what the Oregon Health Plan is. So Medicaid is the nation's medical assistance program for people. And in Oregon, we call the Medicaid program the Oregon Health Plan. The Oregon Health Authority administers the Oregon Health Plan. It is a free healthcare plan for children, teens, and adults who live in Oregon and meet criteria, including income criteria. And people can apply to be on the Oregon Health Plan at any time during the year. So there's no limitation on when folks can apply and enroll with the plan. Next slide, please. In terms of the 1115 Medicaid waiver, which you may have heard us reference a lot, just a little background here. The federal government has a standard set of rules that all states need to follow in order to receive funds to fund the Medicaid program that each state administers. And as a state, we can ask the federal government for permission to change some of these rules to get a little bit more flexibility in how we operate our Medicaid programs. So this is essentially called a Medicaid waiver, hence the word waive, because we're asking to waive certain requirements on how we administer the program. And really, these are opportunities for states to add additional coverage or services to their Medicaid plans to better meet individuals' healthcare needs and improve health outcomes. So our most recent 1115 Medicaid waiver that we had approved from the federal government includes health-related social needs, or HRSN services, as an Oregon Health Plan covered benefit. I will say this is the first time that health-related social needs have been covered by Medicaid. So it's an exciting initiative for sure. And Oregon is at the forefront of these initiatives. And I'm very excited to bring this to you all and hear some input today. Next slide, please. Before we get into kind of the conversation here around authorization timelines, I just want to pause to see if folks have any questions on health-related social needs services or the waiver that I can answer. I know that was a quick overview, but I just wanted to pause and see if folks had specific questions. Just a reminder, the health-related social needs services that we had approved in our most recent waiver include climate-related support, so air conditioners, air filtration devices, portable power supplies, mini refrigerators, and heaters. And then we will also be rolling out a new housing benefit and nutrition benefit as well as outreach and engagement supports to help individuals get access to additional services they may need beyond the health-related social needs services. Okay, so we wanted to get some feedback today on service authorization and delivery timelines related to the new health-related social needs services. So some context, we've already launched our climate benefit, which launched our HRSN climate benefit, which launched March 1st of this year. And so we had collaboratively developed a timeline for authorization and delivery of those devices prior to that March launch date that detailed how long coordinated care organizations have to authorize climate devices for members. So what we're doing now ahead of the launch of the HRSN housing and nutrition services is we want to take a look at the requirements, the contract requirements related to these timelines for authorizing the services, specifically for the housing and nutrition services, understanding that current timelines we have for climate may not be appropriate or consistent with the goals that we have for preventing homelessness and addressing food insecurity in a timely manner for our members. So the goal of these next few slides here is to gather your feedback on the housing and nutrition service authorization and delivery timelines, and really looking to hear about your experience in delivering these services and how these timelines would align with the work that you've been doing. Next slide, please. Okay, so we'll start with climate service authorization and delivery. So this is a proposed timeline for what we would be updating the climate authorization and delivery timeline to. It is a little bit different than what we currently have, but we wanted to start with this as a foundation. So in terms of sort of the clock to when a member is identified to needing a device to when the timeline for the member needing to be provided with that device, we have a proposal here. So as you can see on the left, before day one, so not there isn't a requirement here in terms of a timeline for a member being identified. So we don't have a timeline there, but say the member is or the individual self-refers they need an air conditioner, they need a climate device, or they're identified by an HRSN connector. That could be a provider that they work with, it could be a community-based organization, anyone who can help connect them to the service or start the process. So that's before day one. Once that has happened, the member is identified as needing this service, there would be a request that would go to the individual's coordinated care organization, or if they're on Open Card, it would go to the Open Card program. And so then at that point, when that request for the service comes in, that's when the timeline for service authorization would begin. And the proposal that we have is that it's up to 14 days. So it doesn't necessarily mean it would take 14 days, but up to 14 days. And within that period of time, the coordinated care organization would receive that request, review it, complete any eligibility determination that they would need to any information they would gather to make that determination, and then authorize or deny the request, and then inform the member. So all within up to 14 days. I do want to note, so the little star there, a 14-day extension is allowed. If it's required, it would need to be requested by the member, the provider, or the contractor. And the contractor or the CCO must provide a written notice to the member to demonstrate the member's interest in the extension. So there is a potential 14-day extension during certain circumstances, but it would need to be in the best interest of the member to be able to receive that service. So then after that 14-day period, so the member has already been authorized for the service, they'll receive that notification soon after. Then we have a new time frame to work with, and it's a 30-day time frame for the member to receive the device that they've been authorized to receive. So the climate device, whether it's an air conditioner, air filtration device. So the CCO or the open card would refer the member to a provider or a vendor if that's necessary to deliver the climate device. It's also possible and likely that the CCO would just order the device online and have it delivered to the member. If the air conditioner needs to be installed, the provider or the vendor would initiate and deliver the device and then install it as well. And our expectation is that happens in under 30 days, within 30 days. If it needs, for some reason, there's an issue with supply, then the CCO would need to contact the Oregon Health Authority and let us know that there's going to be an issue getting that member the device within the 30 days. And then OHA can help problem solve so that we can get that member that device before the 30 days or as soon as we can after, depending on supply issues. So these are our timelines that we're looking at. So you can see it could be potential 4 to 6 weeks. I will say that in some cases it would not be that. The expectation really is the CCO would authorize the service as expeditiously as the member's condition requires, but no later than the 14 days following that initial request. With this, I will acknowledge that climate might be a little bit different than housing and nutrition, and the total time of 4 to 6 weeks could be too long for the delivery of housing and nutrition services. Before we move on to the housing and nutrition, I just want to pause here to see if folks have questions around the authorization and delivery timeline specific to climate devices.
Please feel free to either verbally ask the question or write your question in your chat. There is one question here.
Is there a way to expedite requests? So the current rule language on this is that the CCOs would authorize them as expeditiously as the member's condition requires. So there should be, yes, there should be a way that depending on the member's need, their condition, specific condition, that can happen quicker than the 14 days. There's also language in there that if it's an expedited authorization decision, it would need to happen no later than 72 hours. But those are specific circumstances where the member would need to qualify for that expedited process.
Yeah, hi, this is Carissa. Just to follow up on that, which thank you for answering that. But is there information that's made available in an effort, to be transparent with the person requesting or the member themselves that they can access to understand what would be needed to expedite it?
Yeah, we can follow up on that. I mean, I don't have the exact language in front of me, Carissa. Thanks for asking. But the 72 hours expedited process, my understanding is it has to be the members. There's a significant health risk or the potential loss of life for that situation. But I can get more firm information on that, and we can absolutely provide some information on our website or in our other materials that would help members understand those situations. Thank you for bringing that up. And happy to take recommendations as well. And if in your experience, if there's specific, feedback you have in author or delivering some of these services that we're talking about today, and what would be in the best interest of members. Okay, let's go ahead and move to the housing and nutrition timeline, which is a little bit different. Before we get there, I just wanted to remind folks what the specific housing and nutrition services are, so you can kind of get an idea of what types of services would be authorized and provided. So under the approved health-related social needs services for housing, eligible individuals will be able to receive rent or temporary housing and utility costs, utilities arrears, utility setup, as well as storage fees, hotel and motel stays during home modifications. If the member's home is being modified for like a medically necessary home modification, there would be hotel motel stay allowed. Pre-tenancy housing transition navigation and tenancy services, and then medically necessary home modifications and remediations. On the nutrition service side, that would include medically tailored meals, for the initial assessment with a registered dietitian nutritionist, which is RDN, pantry stocking, meals, fruit and vegetable prescription benefit, and then nutrition education. So thinking about these are the services that would be potentially authorized, and thinking through the timeline of what would the impact be based on the timeline we're proposing for these services. Next slide, please. So as I mentioned in the climate slide, the timeline we proposed for climate may not be aligned well with the goals that we have for housing and nutrition. So we're looking at a shorter timeline, and the rationale behind that would be to ensure members are connected to the needed services as quickly as possible. And in particular to support homelessness prevention as a key population of focus. Next slide, please. So here's our proposed timeline that would be specific to HRSN housing and nutrition service authorization and delivery. And I want to pause for just a minute and call out that these timelines are specific to health-related social needs services. So they wouldn't be applied to other Medicaid covered services that are not HRSN. So for this slide, we're talking just about housing and nutrition. So the authorization, again, on the left, before day one, no specific timeline for identifying individuals that may be eligible for the benefit, as individuals can self-refer them to their CCO or to OpenCard. They can be connected through an HRSN connector, who could be a provider, organization in the community that they work with that can help them get connected to their CCO or OpenCard. But in terms of the authorization timeline that we're looking to put in contract and then rule, it would be similar to what we just shared on the slide before with climate, up to 14 days, or as expeditiously as possible, depending on the member's health condition. So from day 1 through up to day 14, what would happen is the CCO receives that request, either from the member or the provider or community partner. They review the information, they complete the eligibility determination, and then would need to authorize or deny the service and inform the member. So that would be up to 14 days. That is standard for other Oregon Health Plan covered services. Just want to highlight that, as well as the 14-day extension. So that would be included as well. And that would be, again, as requested by the member, provider, contractor, in the member's best interest for that extension. So then after that, this is where it gets a little bit different, specifically for housing and nutrition services, where we deviate from other covered Oregon Health Plan service timelines. So what we would expect is that the CCO, after the authorization is made, refers the member to a provider or a vendor for the service, the housing or the nutrition service that they need. and then the provider vendor initiates and delivers that authorized nutrition housing service within another 14 days. So service delivery would then be within 28 days. That would be the maximum, unless, of course, there's a 14-day extension. Okay, I'm going to pause there, and I see that we have a hand.
Hi, thanks so much for doing this. My name is Laura Johnson. I work with sponsors in Eugene, and we provide transitional housing as well as long-term housing for folks with conviction histories. So the question that I have is, so I think most of our referrals would be provider referred, or requested anyway, rather. And then, so this looks to me like we could bring people in and then make that request while we are providing the services, and it could backdate. Is that accurate?
That's a great question. If we could retro authorize the service that you're already providing, is that what?
Right, because in our transitional housing program, for example, people come to us the day that they're released from incarceration. So they wouldn't be OHP members prior to their arrival here. The prisons are doing a better job of trying to get people enrolled while they're incarcerated, but they're not effective until after they're released, as I think you probably already know. And so they come here, they otherwise would be homeless. So they come to us the day they're released. So we would start by, that would be kind of day one for what we would be requesting the support, financial support from OHP or from the CCO for, but they'd already be here. So we'd be submitting it post date, I guess, if that makes sense.
That does. To qualify for HRSN services, the member or the individual does already need to be enrolled in the Oregon Health Plan. So that definitely presents a challenge there.
That's okay. They get enrolled the day they get out.
Mm-hmm.
So with that, so we wouldn't be billing for anything prior to their enrollment. That's
okay.
Be very clear about that. Yeah,
Okay.
That's clear to me. So with that in mind,
yeah, I wonder if I see that Kelly.
Yeah, I guess I don't have a firm answer, to tell you the truth, because I think this is something we've started to flag, and I just want to make sure I'm understanding your question so I can add it to the discussion points that we already have. So this is retroactively going back and determining if HRSN can be used after the expense is paid. So it's really a question about the retroactive kind of coding of money, like what color of money you would be using.
I think so. I mean, they'd still be here. So average length of stay here is 90 days. I have no idea like how your fee schedule is going to be or what you would even cover. So I don't, but right, they would come here. I think you're going to run into this a lot with homeless service providers of like, you want to, like, people are going to land in your services first, and then you'll realize they're OHP members. And then if it's going to be provider requested, initiated request. And so then the question is, do we need to, if during that first 14 days, that's when I put in the request, and then I wait until after the request is authorized, and then I can't bill for HSRN services until after the authorization? Or does it go back to, can I go back to the place where they landed with us, and assuming of course that they are enrolled in OHP at that point?
Yeah, okay. I think we have to continue internally kind of our discussion on back end payments. But one thing I do want to clarify, and I put it in the chat, that so our focus on phase 1 is the prevention of homelessness. And so it means that we're supporting people who need support maintaining their current housing, and really focused on rental support for individuals paying rent. And so I just want to state that in case you or anyone on the call are thinking of this more as like, I just want to clarify it's to, our eligibility is focused for phase 1 around supporting people to maintain their current housing as opposed to moving to different places. That's not the question you asked, but I wanted just to clarify that piece.
I appreciate the clarification. I guess I'm a little bit confused because I also know one of the priority populations is people releasing from institutions.
Yeah. Yeah, I think that we have to perhaps do a more clear job of explaining eligibility. So that population is, you mean within the at-risk definition?
No,
Or
when you look
just
at the
in
actual
general?
HSRN priority populations,
Right.
it specifically calls out people releasing from institutions and including prisons.
Right. So not all covered populations are eligible for housing services. Right now, with housing services specifically, only people who meet the at-risk definition and who need support staying in their current housing are eligible for HRSN as of November 1st. Now, for nutrition services and for climate services, all of those transition populations apply. But I appreciate that it's confusing and that we haven't released kind of something written that really clearly outlines all of this. And so we have it on our list to do so soon. Jesse, I don't know if you'd add to that.
Yeah, I'll add. So in terms of what CMS has authorized us to, so they're the transition populations, we're looking at different phases for the in terms of implementing the benefit. In terms of the November launch, it is only housing services are only available to individuals who meet the at-risk definition. So we will absolutely come back to this group with more clarity on that. But in terms of the November launch, it is limited. It's not open to all transition populations who we received the authority for in the waiver. Does that help, Laura?
It does. How long? I see somebody else has the same question. How long would you anticipate? When do you anticipate phase 2 would begin?
That's still to be determined. We're still working through that now, but in 2025, later in 2025. But we will release additional details as we're able to.
Okay, and then this may be a silly question then at this point, but in terms of do HSRN, if we apply to be an HSRN provider or HRSN provider, do we have to accept referrals from the CCOs? And I'm asking because we have certain eligibility criteria as only serving people released from incarceration.
Sorry, can you repeat what?
Yeah, sure. So I think so on this timeline, so in that day 15 to day 28, it says, you know, CCO refers member to a provider or vendor. And that, so I'm assuming these are people who are, you know, self-requesting. And so I'm wondering if as an HRSN provider, should we go that route? Must we accept referrals from the CCOs to us? Because we have a pretty specialized program, and so I just want to be sure we're not setting ourselves up to be receiving requests to serve people that aren't more eligible for our services.
Yeah, that's a good question. If you're serving a different population than who's eligible for the November launch, yeah, that makes sense. That maybe you would not.
No. Sorry, no, I meant like down the road. Let's imagine we're in like phase 46 or whatever it is, and everything's fully implemented, and we're an HRSN provider. Do we have to accept referrals from the CCO? Like, can you just make referrals to us without knowing that if somebody's eligible for our services? Or can we say we're not receiving referrals from the CCOs, we'll receive self-referrals and our own initiated requests?
So, okay, I understand the question. Yeah, so if you're receiving referrals from the CCO, you would be in that CCO's network. You would have a contract to be in that CCO's network, and you would accept the referral if you are able to provide the service and willing to provide the service. In terms of the member coming to you, like self-referring to you, saying they need the service, that would then, you would need to send that request on to your CCO or the open card, fee-for-service open card program with OHA, to then review that request and authorize the service before you would be able to provide it and bill HRSN.
Thanks. I know I took up a lot of airtime. Appreciate it.
Thank you for the questions.
I think Lisa has some more information on that. Lisa Croix. That your organization can define the scope of population that you are serving in your contract with the CCO.
Yeah, just a little more detail from what Jesse provided.
Yes. So if you are not able to provide services to that population, then that is clearly mentioned.
Thanks for the questions, and that's what we're here for, so no worries about asking, taking up time. Let's go to the next slide. We do have some questions specifically around the timelines. I know we've kind of heard these a little bit already, but just curious in thinking about the member who needs to receive these services in a timely manner. What do you see the challenges are in these specific timeline requirements? Do you have specific ideas for how this can be streamlined based on your experience in providing these specific services? And then if you are or plan on becoming an HRSN service provider, how do these proposed timelines align with your timelines for delivering these services? Okay, seeing in the chat some additional consideration on retroactive payments. Thank you. Callie, any other things that you want to highlight? I see you're putting stuff in the chat. I wonder if you want to talk a little bit about some of the links.
Yeah, I linked to the at-risk of homelessness definition. I think, so we're using the official HUD definition. It has a income threshold, which in some but not all parts of the state is lower than the income threshold to qualify for Medicaid. It specifies that an individual lacks resources to maintain their housing. And then there's various other components to the at-risk definition. So an individual would need to meet all kind of 3 components, and that third component has, I think, up to 14 different scenarios that would apply. And so it could be that someone's severely rent burdened or has an increased risk of health issues. And a few others. And so the idea is that since we're taking a preventative approach with housing, someone who has a kid who's sick and they need to take time off work, or they work seasonally and the season is slowing down, that they could anticipate needing support making rent and seek these services in that anticipation. So that's kind of I guess the aim for HRSN housing in phase 1.
Thanks for adding that detail, Callie. Any final thoughts on the timelines? Just curious if folks have specific experiences or scenarios they can think of that would be challenging with these timelines. And I shouldn't say final thought. If you have additional feedback or comments, we'll have our contact information listed at the end for you can absolutely reach out. See another question in the chat. To help clarify what a pre-tenancy is available, do you have a discrete list?
Yeah, we do. Yeah, thank you for that. We do in our service descriptions, and we've gone over service descriptions in a past HRSN partner session. And I think, Jesse, we do have plans to post them at some point once we do a little bit more tinkering. But yes, we can share those.
Carissa, thank you so much for your comment in the chat. Shorter timeline would be better, and sounds like it looks like someone else agrees as well. I'm curious if you have specific timelines that you would suggest, or where some of this can be streamlined a bit for how you provide services.
Well, I can speak from a person with lived experience that typically you're not planning for this to happen. It's something that happens like literally that day, the same day you need housing. So it just seems like, which I would love for others to continue speaking up. Their comments are great. Just I don't know what's possible, what that looks like. But a much shorter timeline would definitely be, in the effort of the overall goal of being preventative, that would achieve that. Whereas 14 days most likely is not going to help.
Yeah, I hear you. And I think, Jesse, do you want to talk? So one of the, I guess, components of this, like the trade-offs, is that, so from when that clock starts on the first day, the CCO has to be in touch with the member to compile all of the eligibility documentation and information. And then they have to work it through their system. I think we've been worried that, and this isn't this is kind of like this is just to kind of explain why 14 days as opposed to 10 or 20. Not necessarily saying that we can't consider how to change it, but we wanted to specify a timeline that would allow sufficient time to work with the member to get the eligibility, without kind of providing an unintended incentive to just deny people because they weren't hitting that like kind of cutoff. So it would be easier just to send a quick denial rather than giving enough time to make sure that all of the information is there, goes through the system, any follow-up that is needed can take place. I think we were trying to guard against an unintended consequence or incentive to, if you don't have all of the right info, to just deny rather than like working with the member to get the information together. So that's kind of the other piece of it. And wondering, and I think this is just a challenge of this being a Medicaid benefit, that we have to like set a timeline, whereas with more flexible funding like grants, you can just say kind of as soon as possible, and that's okay. With Medicaid, since it's not so flexible, we do have to specify our intentions. So I'm wondering, of course, as soon as possible would be best, but is there a threshold that you see as being, and for eviction prevention, we know like the 72 hours, that I think probably wouldn't be enough time to kind of move things through the system. So just wondering if there is another threshold that kind of makes sense given that additional context, and wondering if that additional context kind of helps.
I appreciate that. Since I don't have all the answers, I mean, it's something I would definitely want to research, but I'm assuming,
Yeah.
you know, with all these people in the room, like if they have that information, to please speak up. Or I don't know if that's something OHA can do some research on effective like prior authorization timelines that don't result in that. I just know from actually, I guess I'm fortunate to have a best friend who works in prior authorization in Washington. And so I do get some, or, you know, she works in utilization management for a health insurance Medicaid that, or company that serves Medicaid, sorry. And so it's interesting to hear some of the insights, which it sounds like the CCOs are the ones who are responsible for obtaining the information. They're the ones for reviewing and authorizing it. I know that one of the things that really slows down prior authorizations is that lack of information, and making sure that whoever's referring to the CCO is including as much information as possible. So I don't know if there's some way to get ahead of that in terms of making sure there's really good training and quality improvement around that, and evaluation focusing on that as we get started with it.
That's a great point, and to make sure our guidance is really clean. And the other thing is, I mean, as I'm sure you've heard us say, since this is a demonstration, so we're trying to demonstrate how this could work in a Medicaid context. The other piece is collecting data on how long these authorizations take, and what practices we could instill to make them move faster, or if yeah, I mean, that's just kind of another component that I'm thinking about as you were talking.
Yeah, thank you, Carissa. And thanks, Callie. I'm going to flag something I see in the chat specifically around flex funding. So yeah, if a member is denied for HRSN, they would be potentially eligible to receive the service through HRS at the discretion of the CCO. And so we have advised CCOs to, or recommended that in their denial letters for HRSN, put information about potentially receiving the service via HRS flex funding. So that is a potential there, and may be, you know, a better avenue in certain situations. I see a couple other questions. Can you provide additional detail about what a provider needs to submit for each member seeking HRSN services? So to initiate the process to be screened, so the screening and confirming eligibility is the role of the CCO or open card. If an individual goes into a community-based organization and presents the need for a request, an air conditioner or housing services, the provider or connector, if they're not an HRSN service provider, can use an HRSN request form that we've included on our website. And it can be partially filled out, but at the minimum, the information that needs to be compiled and then go to the CCO would be the member's contact information, their name, their Medicaid number, and then which service are they requesting? Is it climate device? Is it housing? Is it nutrition? And then the provider will send that to, or the member can self-refer, send that request form to their CCO, or they can send it to the open card if they're not enrolled with a CCO. So we have that on our website, those forms, the HRSN request forms. And actually, I believe, Satya, at our next session, we were planning on doing a deep dive on the HRSN request forms.
That's true.
All right. See a couple of other comments have been added to the chat. Yeah, Sylvia, to your comment, having the information upfront in the HRSN request form will be helpful, definitely, I think to expedite the process.
There's another question here from Dina. Does the CCO determine all applicable eligibility criteria or just the qualifying condition part of it?
The CCO is responsible for determining all eligibility. The provider, so the HRSN service provider, who would be, if you're an HRSN service provider that would be billing for the HRSN outreach and engagement, you would at the minimum need to confirm the member is on the Oregon Health Plan. If you're not an HRSN service provider, you're helping the member get connected, but not serving in a capacity as an actual HRSN service provider, you wouldn't need to do anything like that. You would just need to help with, connect them with a request form that would go to the CCO. So it kind of varies depending on the role that you as a provider are wanting to play. If you're seeking to become an HRSN service provider, there's a whole Medicaid enrollment process and activities that you can bill for. And I know we've been covering those in our HRSN technical assistance sessions.
And Callie just responded to another question from Karen, who wants to know about how the funding flows from CCO to HRSN provider. Oh, there's another question. In what circumstances would a member need to be reauthorized? This is from Leslie. Is there any need for reauthorization?
I think if the person's if they were denied and the person's circumstances changed such
Right.
that they became eligible, they could be reauthorized? Or do you mean could they
Second
receive the
time?
same services multiple times? And that depends on the service. For some services, you can receive it multiple times, and for others, you can only receive it once. So the 6 months of rent or any rent amount, you can only receive it once until 2027 when we get the demonstration, when our demonstration ends. But for other things like the tenancy sustaining services service, you can have that at any time.
Thanks, Kelly. And I see Carissa's question about will the information in the request form include everything that's needed from the member to remove the need for the CCO to follow up with the member? Not exactly. The CCO as the entity that's authorizing this service will need to follow up with a member, whether it's the authorization or the denial letter. And then there's also a person-centered service plan component that goes with HRSN services. So individuals who are authorized for HRSN services will be contacted to help develop a person-centered service plan that captures their goals, the service needs, and then also to see if they need connected to additional Medicaid or non-Medicaid services.
Yeah, if I could just follow up about that, it's Carissa Bishop. Which I'm sure other people could speak to this more so than I can, but just thinking about the population we're talking about, I mean, I don't pick up calls I don't know. And I mean, I just don't know how we expect for this to actually work to the benefit of the member when you're saying there's like these imaginary hoops they have to jump through now because they have to make sure they get the call from the CCO and it sounds like there's going to be more than one, or I just don't know. And I know that there's maybe ways we can get ahead of it by having whoever's referring them, letting them know. you know, or having it very explicit. You must go through these next steps in order to get it. You didn't just give all the information or request it and you're good to go. Like there's a lot more you have to do. Or it'd be great to prevent, like to remove those barriers. But if that's not an option, to at least get ahead of it and be very explicit about it.
Yeah, absolutely. Thank you for that feedback, Carissa. We have developed a couple of tools that we've been using with sharing with CCOs as well, specifically on the member journey to try to capture what that perspective would look like. We have a provider journey tool as well. And so absolutely looking for additional feedback on how the process can be better streamlined to ultimately provide the member with the services they need, but to do it in a way that that supports their needs, and exactly as you had outlined. So thank you for that feedback. We'll continue to look at where we can eliminate some of those barriers or burden. And I'm wondering if Satya, do we have those links to those tools that we have in this slide?
Yeah, I'm looking for it and I'll share it.
Wonderful.
Yeah. Thank you.
Okay. I know we are at time for this section, but do we have any final questions, Satya, in the chat that we need to address?
I don't see any more questions. No, Callie has splendidly responded to most of them. So now I think we will move forward to our CCBF portion, Community Capacity Building Funds. And now I'll hand it over to Suzanne. Thank you, Suzanne, for joining us.
Hi, thanks for having me. My name is Suzanne Cross. I use she, her, aya pronouns. And we just have a few slides today. Many of you may have already seen these and be familiar with them, but I also, want to recognize that, some of you, this may be new information. So we want to make sure to support everyone and that you have easy access to information. And we will go through these slides and then spend the majority of the time in question and answer. And I also wanted to take you through our CCBF specific website and the components on there and the resources that are available to support you. Next slide, please. So these funds, the Community Capacity Building Funds, otherwise known as CCBF, are funds that are meant to help future and if there's current, there are a number of HRSN providers already to support the building of the capacity to be able to provide HRSN services. So there are funds that can help eligible entities in what they need to prepare to deliver. And here you can see the list of the types of entities that may be eligible for applying for the funds. The majority of the funds will be going out through the CCOs now in 2024. So we'll get to the timeline in a minute here, but the funding window is currently open. It opened on March 1st and will be open now through the end of May 31st. And then there will be again another funding window open in May. So in 2025, early 2025. And then CCOs are required to report back to OHA, not only to ensure that the funding is being allocated under the guidelines determined by CMS, the Center for Medicaid and Medicare Services, but it'll also help OHA and CMS learn about what is needed across the state to develop this new Medicaid benefit. And it'll help us as staff working in the Community Capacity Building Funds program to understand how and if we need to redirect any processes or adjust any processes for early 2025. Next slide, please. So there are 4 areas of allowable uses of the Community Capacity Building Fund, and CMS has outlined as part of our waiver agreement, broken these down into 4 categories. So technology, so you can see here there's new billing systems may be an example. Other examples might include, you know, modifying or adjusting existing technological systems. So if you're currently working in some, you know, whether it's a community information exchange or some sort of communal app that you use, is there something that needs to be modified to be able to provide HRSN services, whether it's billing services, screening services, or integrating data platforms or tools might be another example. The second is development of business or operational practices. So designing of new workflows. Another example might be the development of practices for the billing process, for sharing data, for evaluating how the program is going. We've been asked a few times, and this question is now in our frequently asked questions, which I'll share in a minute here, or we'll talk about in a minute here, but could organizations use community capacity building funding to pay for review of policies that might need to happen? So, you know, legal review or guidance recommendations of new policies or practices around HIPAA, for example. And that would be an allowable expense under developing these business or operational practices. The third one is workforce development. So examples might include money for staff that have a direct role in either implementing the HRSN services or the billing process, support for recruiting new workforce. When paying for staff, the funding is limited to 18 months. Another example here might be paying for certifications or training programs that the staff need to go through in order to implement HRSN service programs. And the last one is outreach, education, and convening. Convening could be an example of pulling together partners in your region to develop a new learning collaborative or to share resources and tools to helping make sure this benefit is available across the region. Other examples are planning and facilitating outreach events to support the awareness of HRSN services to members. So probably, you know, producing materials, paying for translation of materials. Those are all examples under that 4th category. So next slide, please. So here we have the timeline that I alluded to a minute ago. So as you can see, there's a star on where we are today. And I just mentioned that the funding window is now open until May 31st. So we'll talk a little bit more when I share my screen in terms of the website and resources and information that you might want to consider before applying. This timeline's a bit complicated, I realize, but there's two kind of things I wanted, or a couple things I wanted to point out. One, the window till the end of May, you can apply through the CCOs, which we'll go over in a minute as well. And then also that there's 2 notification time periods. So to allow for the flexibility of the CCOs to engage community partners in the review of the applications that they get for CCBF, we allowed for 2 options of funding or batch review windows. So there's the applications will be due by May 31st, and then there's 2 times where the CCOs will announce who's been funded. And those will be August 1st and September 15th. They may come out sooner. Funding may be available sooner, but it'll depend on a number of factors within the CCOs and the processes and the OHA process as well. So. Okay, and then on the next slide, we're going to go over the website, and I'd love to share my screen. Am I able to do that, Katya and team?
I think Trevor can help with that.
Okay.
Yeah. Let me see.
Suzanne, I just made you a co-host, so
Oh,
let me know if
perfect.
you're able to share your screen.
Barely, or I'll just put it, here we go, okay. Okay, are you able to see the community capacity buildings website?
Yes.
Okay, great. So there's a couple of things that are listed in our slide that I wanted to call out kind of specifically where they are. So the first one that's listed under the resources in our slide, and if someone wouldn't mind, if you haven't already, I do the chat, but putting the link to our website, that would be really helpful. So here is the, the first bullet is our approved infrastructure protocol. And without kind of knowing what that means, it might be hard to recognize the value of that. But this link is basically what's called out by CMS, the Center for Medicaid Services, and the agreement with OHA on what we can do with these funds. So what's allowable, the specifics in here, and what our requirements are, who are the entities that are eligible for the funds, that kind of thing. So this is helpful if you really want to get deep into specifics around the funding. That might be helpful for you, and that's here. Another thing is that I wanted to call out is our email address. This email address will link you directly to myself and my team, which is ccbf.info@oha.oregon.gov. And we've been getting a lot of specific questions that we are more than happy to answer, and we try to do so within a 24 to 48 hour time frame. Sometimes we'll get back to you within the same day. But if you have questions about your organization or your application, or would this be applicable, please feel free to email us and ask any questions. We're also happy to receive any input or feedback through that email address, so we're always collecting those. And then kind of related to that, there's another page here, which is CCBF CCO contact list, and this is really crucial. So when you email us and ask us questions specifically about your application, besides answering your questions, one of the things that we always do is highly recommend that you contact the CCO in which you're applying. So if you link on this contact list, there's a map to the CCO. So if you don't know the CCO in your area, you can follow this map to find out the CCO in your area. And as well as each CCO has a specific email of someone or an email in charge of the CCBF funding process for that CCO, as well as a web page link to the CCBF process in that CCO. So there you'll find valuable information. Some CCOs may have strategies around the funding. You'll want to ask those questions. What are your strategies around the funding? Are you leaning in this area or that area? Here's my ideas, some thoughts for my application. Does this make sense? We encourage the community-based organizations to reach out to their CCOs to develop this partnership and ask them questions. Many of them have had or will have webinars to support the application process. That's on these websites is where you'll find that information also. Let's see. The next thing I wanted to point out is there's a number of questions you can answer here. There's also under CCBF, the application template itself. So while the mode of how organizations may apply to CCBF through each CCO may differ. So there may be websites, there may be a Word document to fill out, there may be portals. That may differ from CCO to CCO, but what will be the same is the actual application and the questions that are being asked, as well as the budget and how your applications will be reviewed. So that's across the state. They will all be uniform, and so you can find those here. And then the last thing that I wanted to suggest is this list of frequently asked questions is available in 7 languages. And it's really where you can find specifics about, you know, well, basically frequently asked questions. So when we have our email and we've gone to these partner sessions, when we hear questions more than once, we've been adding and updating our frequently asked questions. So if someone else has a question, it's likely, you know, if you have a question, it's likely somebody else may have asked that question. And so we highly recommend you open up the frequently asked questions and take a look and read through those before you complete and submit your application. And then I'm happy to stop sharing. We can go back to the slides, and I'd love to look, can't look through the chat while I'm sharing the screen. So let me stop sharing. I'll ask Trevor to take that control. And I think we're ready for question and answer. So I see some. Oh, great question. So Karen asked if there's a place to see the amount of CCBF funds allocated to each CCO. On the website that Satya linked above, there is underneath how organizations can access CCBF on our website. It's about halfway down under the CCBF funding. You can see the list of each CCO and how much total CCBF, their not to exceed amount they were allocated for 2024. And I want to clarify, the amounts that they're allocated for 2024 is the amounts that they can spend, that they can award in 2024. However, from an application perspective, you may apply to use that funding in 2024. You may apply to use that funding in 2024 and 2025. You can, as long as you spend that money before the end of the waiver period is over, which for the case, this purpose will be September of 2027. That's okay. So you can have an application that's just for this year, or it can be for multiple years. Okay, great. And Karen found it. I don't see any other questions. Are there other questions that people want to ask? I can answer them if I can.
Have anyone already applied for these funds? They have started the process and are going through anything? Any barriers? Then we can also discuss those things. Yeah.
You're asking the group if anyone's applied through their CCF.
Yes. There is another question from Leslie Gone. Can you share more on the rubric and how it is assessed?
Yeah, I'm happy to. If you open up the rubric on our website, you can see that there's certain areas that are requirements. You know, so the organization has to be able to meet certain requirements. The organization has to attest that they intend to become an HRSN service provider. That is another question that we get quite frequently, like this: does an organization have to apply or go through the process of applying to become an HRSN service provider before applying for these funds? They do not. They can be anywhere in the process or just considering becoming or hoping to become an HRSN service provider and apply for these funds to help with that process. And then, you know, there's some, like I said, back to the rubric, there's some must meet requirements, and then there's general guidelines for asking, you know, what are the demographics that the organization is serving, and their requirements on the CCO side in terms of, are they reaching out to diverse organizations across the region? in terms of population and language access. And then are they, culturally responsive are they reaching out to culturally responsive organizations? And then I will again, remind CBOs, it's a really good idea to ask the CCO specifically or to look and research what their, if they have any specific strategies for the money in terms of building out their infrastructure.
There is another question from Connie, and I think it's a very good example of what is provider responsibility versus member benefits. So they're asking if applying for CCBF funding from multiple CCOs, is it best to ask each CCO for different areas to fund, or rather ask each for a percentage of the same area? So it's a very good question. And then for that particular question, they have given an example of a commercial refrigerator would hold food for all of the CCOs we plan to apply to. Do we ask one to fund or ask each CCO to pay for a percentage?
Yeah, it's a really great question, Connie. And I think, it's a great question. And it also calls out that you're aware that community-based organizations or organizations can ask multiple CCOs for funding. You don't have to send an application to only one CCO if you're in an area, if you serve an area that's served by multiple CCOs. So thank you for calling that out, because it's important for people to recognize. I think in terms of your question, I don't have any advice for you, except to say that this is a perfect example of where you might email both CCOs that you're applying to. Because I know, for example, I saw up earlier in the example of Pacific Source and Trillium, Pacific Source, Lane County and Trillium, those two CCOs are working closely together on reviewing the applications. And so I think that it would be a good example to suggest, here's how I might separate this funding, or do you have any, if a CCO is leaning hard on nutrition services because they really feel like that's an area they need to grow out in terms of funding, and another one is not, then maybe you would want to, put this specific request in the one application. So I think you're better off getting an answer from the CCOs directly. And there was one other thing I was going to add, but it just slipped my mind. So if it comes back to me, I'll add it in.
Do we have any more questions?
Oh, I know what it was going to be. On the application, for those of you that haven't yet spent time looking at the application, or there is a question specifically calling out organizations to answer if they've applied to other CCOs and for what. So you can use that question to help, after you do your research and gather input from the CCOs directly, which I would highly recommend. You can also use your answer and that question in the application to explain your thinking. And, particularly, I would recommend if your success through one application is dependent, or your success through the application is dependent on another application success, you might want to specifically call that out in your application response. Anything else?
We don't have any more questions. We'll give 5 more minutes and wait if people come up with any questions, or else we can close. I do have a question, general question though, Suzanne. Do CCOs communicate with each other regarding, suppose I am a provider and I have mentioned in my application that I have applied for these funds from another CCO. And then I have mentioned it in my application. How does it impact the application in general? Or does it have any impact?
We don't have any specific rules or guidelines around that. And, you know, I think it's our hope. We'd like to see that the CCOs, some of the CCOs are working together when they
Right.
cross over a region. I think the intention is really, you know, across Oregon, the hope is that this funding can help develop a strong and diverse HRSN service provider network. And I know that the CCOs that we've been talking to, that their intention with the funds is really looking at, you know, what areas do we need to uplift and support because maybe technology is a real struggle, or maybe
Right.
This specific HRSN service is, you know, lacking in our region, and we need to really support organizations that would be able to offer it. So I think it really depends, and we don't have any specifics on CCOs doing that.
Thank you. There is a question here. I don't think it is CCBF specific, but it asks, Laura asks about, will there be a fee schedule provided for HRSN items, that is maximum amount per day, per month for housing, nutrition support, etc. And yes, we did have a session or 2 sessions on it actually in April on housing, one session on housing and nutrition support that are proposed fee schedules. And we also solicited some feedback from you all, and we got a lot of feedback to help prepare this policy. As you all are aware, this is a demonstration waiver. That means it is the first time that is happening, especially with regards to housing, climate. But it's a demonstration, and that means we are making these policies as we go, and your feedback helps us make these policies more friendly for the community we live in. So yes, in short, Laura. Another question is here, Karen. In order to be a HRSN provider with a particular CCO, do we have to apply for CCBF funds from them?
That's a great question, Karen. So no, the process of becoming an HRSN provider and the process for applying for CCBF funds are 2 separate processes, and they're not intertwined. You can apply for CCBF funds, like I mentioned, and then not apply for HRSN to become an HRSN provider because maybe it was too daunting or something happened or whatnot. Or you can apply for CCBF funds and then also apply to become an HRSN service provider. So they're completely separate, and you do not have to apply for CCBF funds first in order to apply to become an HRSN service provider. And then there's some more questions around the fee schedule.
Yes. When will the fee schedule for housing and nutrition be finalized and shared? I'm hoping that is obviously before the, by launching, when we launch it, the services. Callie, is Callie or Julie here? There is also another question. Oh, Callie is here. Sorry. Yes, Callie.
Yeah, I actually am not quite sure the precise date, but yes, it is on the radar to getting it done soon.
Yeah, hi, this is Julie here. Similar, I mean, that's really payment team that finalizes that date. Thanks.
Thank you. Another question from Laura. I think it is a general question, and how will we know when the demonstration will be moving into the next phase of implementation?
And by that, do you mean like the next phase for housing eligibility?
Yes. Yeah, like when you were saying, like, it related to the opening up housing eligibility to more than just that at risk of becoming homeless population.
Yeah, and specifically within the at-risk people who are currently housed and need support maintaining their current housing.
Right.
Yeah, I think that's a great question. And since we've been so focused on this initial phase, I don't have an answer. But certainly there would be a lot of publicity around it when that happens.
Do we have any more questions? Perfect. We'll wait for 2 more minutes and then we'll wrap up. Give some 20 minutes back to doing whatever is fun. Thank you so much for joining us today, everyone. Please feel free to write to us whenever you need any support regarding HRSN services as a provider or as a partner, so that we can provide further sessions and also help our policies be more friendly and supportive. Thank you so much.